Bismillahirrahmanirrahim. Our topic is about semen analysis. I am mainly addressing my fellow gynecologists. Hope this will be beneficial. So, semen analysis, how to assess. Semen analysis is examination of the freshly ejaculated seminal fluid. It's a keystone in the clinical evaluation of the fertile male. It includes examination of spermatozoa regarding count, motility, morphology, seminal fluid, like volume and pH, and other cells as white blood cells and red blood cells. The indications, of course, assessment of the male infertility, other indications as after vasectomy surgery to confirm the absence of sperms, and in other medical legal purposes. The parameters measured by semen analysis are only some of the factors determining semen quality. 30% of men with abnormal semen analysis actually have abnormal sperm function as evidenced by the sperm function tests. In response to the growing need for standardization of the human semen, the WHO first published a laboratory manual for examination of human semen in 1980. This was followed by another 3 editions, and with some recommendations for the need of revision, the WHO established the 5th edition in 2010. How to evaluate a semen analysis? The sample should be collected after a minimum of 48 hours and no longer than 7 days of sexual abstinence. We should ask the patient. If more than 7 days, the sperm motility would decline. If less than 48 hours, sperm count may be reduced. Typically, 2 to 3 semen analyses should be obtained over a 3-month period before making any final conclusion. A recent febrile illness, exposure to gonadotoxic agents, may affect spermatogenesis for up to 3 months. Therefore, semen analysis should be postponed. What to look at in semen analysis? The volume, count, liquefaction time, total motility, progressive motility, morphology, and the white blood cells count. Infection affect all other semen parameters. It's of huge importance. What are the normal semen parameters? According to the WHO 2010, the normal volume is 1.5 milli or more, pH 7.2 or more, the count 15 million per milli or more, the total sperm count per ejaculate is 39 million or more, the total motility 40%, progressive motility at minimum 32%, morphology of the normal forms 4% or more, and the white blood cells count should be less than 1 million per milli. This is some definitions which is useful in anyone reading semen analysis. Oligospermia means sperm count less than 15 million per milli. Acinospermia, either a total motility less than 40% or progressive motility less than 32%. Teratospermia means that the percentage of normal forms is less than 4%. The abbreviation of OAT stands for oligoacidoteratospermia. Azoospermia, of course, no spermatozoa. Polyspermia means more than 200 million per milli. Hypospermia means a volume of less than 1.5 milli. Hyperspermia more than 6 milli. Aspermia, which means no semen, even semen, the seminal fluid. Pyospermia, which means 1 million per milli YBCs, more than 1 million of white blood cells. Hematospermia, RBCs and semen, and of course necrospermia, which means that sperm. Volume abnormalities. Low volume, which is less than 1.5 milli, could be due to one of the most common reasons, incomplete collection of the sample. Also obstruction, whether ejaculatory duct obstruction or bilateral congenital absence of the vase, and in diabetic patients suffering from retrograde ejaculation. Other abnormalities in liquefaction, viscosity, and pH, which could signify a prostatic dysfunction or also incomplete sample collection or an obstruction. Abnormalities in the count could be due to various causes, including varicocele, radiation, infection, genetic disorders as Klinefelter syndrome, and hormonal imbalances. Whether less than 15 million, which is oligospermia, less than 5 million per milli, and now less than 1 million per milli, severe oligospermia, and we do recommend the cryopreservation in this case, and azoospermia. Also, conditions like smoking, obesity, varicocele, orchitis, radiation, exposure to gonadotoxins, and infections could affect the motility and the morphology. Semen analysis is a simple, non-invasive, and inexpensive tool for the assessment of male fertility, so please ask for it. For better ICSI results, having count doesn't mean that the ICSI is suitable for the patient. Other parameters should be checked. Infection, for example, should be treated. Even with normal semen analysis, sperm functions may be affected, which will need further evaluation. So please don't hesitate to refer the patient to the andrologist whenever you encounter a problem in the semen analysis that is for the patient's benefit, your benefit, and of course our benefit, the andrologist. Thank you.
Thank you, Dr. Ahmed. Next.